I'm Dr. Huang. I'm a psychologist in the Los Angeles area, and I receive several questions on my website, www.drtaji.com, from prospective patients with various questions that they have about the therapeutic process. So what I thought I would do is put together some informational material and present it to you to answer 3 of the most important questions that I often receive on my website and my blog. The first question I'd like to address is, what kind of help can I expect from therapy? What is therapy about? What types of therapy are available? And what types of therapy do you do? 2 is, what can I expect during the first session? So when I come into therapy, we decide upon a time, we meet, and I come in for the session. What do I expect? What's it going to be like the first time I come in? Really important question, and let's address that. And the third issue that people often want to know about is, how much does therapy cost, and do you accept insurance? So I'm going to try and give you a general overview to answer each of these questions so that you will have a better understanding and be a more informed consumer when seeking out therapy services for yourself. Are you ready? So typically, when you first come into a therapy session, or when you're seeking therapy, a therapist has forms that they'd like to go over with you. So we're going to sort of go answer number 2 before we answer number 1, because the process is going to make more sense in that way. So when you come into therapy, the first session should generally last anywhere from 1 hour and 15 minutes to 1 hour and a half, because there's a lot of paperwork that needs to be filled out, and it's a general assessment process. Now, thereafter that, each session, typically weekly sessions, depending on the plan that you and your therapist set up, will last anywhere from 45 minutes to 60 minutes, depending on what you're covering in each session. But today we're going to focus just on the initial session. So to address this second question, what can I or should I expect during my first session? I thought maybe we would do a sort of a vignette to show you what a first session typically begins like, so you can see what the process is generally like before we go into an explanation of other information. Hi, I'm Dr. Huang. You here for your first session? Come on in. Please, have a seat. Make yourself comfortable. Did you find the location okay? Great. All right, so initially we're going to start off with some paperwork, and after I go through the paperwork with you, then we'll start to get into what made you come in today and what's been going on that made you want to seek out some help because you thought that you needed some support in helping you through what's been going on. So let's begin. I have these already prepared for you. So when you come in, the therapist will typically greet you, and after the greeting process has occurred, then you're going to sit down and they're going to give you a packet of papers to fill out. Those papers generally consist of, and every therapist has a different way to cover these, an informed consent form, which we will go over, a HIPAA notice and privacy policy, which the federal regulations say we have to provide, a general information form, and maybe some releases of information. So let's start with the simplest. Releases of information. Releases of information are forms that you'll fill out that at the therapist's request, because one, you've seen another therapist or you have a complicated medical history, and the therapist will need to request records from other treating doctors. And all of your information that's maintained in therapy is protected and confidential. That means that it cannot be disclosed for any purposes, any purposes, we'll come back to that, unless you give your written authorization to do so. There are unique instances in which a therapist can get a verbal consent but later have you sign a written release to do so. So that's in order to access your medical records. And so the release will be very detailed and specific, referring specifically to that you're allowing this therapist to get information from another treating physician or therapist for a specific purpose, and that usually these releases are generally good for 90 days. So that's a release of information. let's go over informed consent. So remember I said that there was a clause to the one piece of information where I said that no information can be released without your written consent. The informed consent process can be very detailed. Now remember, I said I'm going to just give you a basic overview of this process. For more detailed information, you can always visit my website at www.drtaji.com, and a detailed explanation of this informed consent process is there for your perusal. HIPAA goes into all, the HIPAA policy goes into everything, or your privacy policy goes into what's called protected health information. The use of protected health information, when protected health information is disclosed, and all of your rights that you have in relation to that. So that form is a very detailed form, and it goes into that. And lastly, the therapist is going to have some form or means to conduct an assessment. So they're going to get some historical information from you, and they'll have different means to collect that information. But they need to have historical information so that they can determine what's been going on, how long it's been going on for, when it started, if that's the only problem that you're having, and sort of develop a timeline or a really detailed understanding. I like to call it, I'm putting together a jigsaw puzzle, and there are different pieces that are out there, and sometimes you have difficulty putting them together, and that's where I come in. I help you put it all together so it makes a coherent story, so that I completely understand what's going on in your life, so that we can better make a judgment or an assessment about what's the best way to go about helping you. What would be the best therapeutic plan that we could come up with. So that is the answer to the question. One more piece that I think that is important to add, that the assessment session or the psychodiagnostic evaluation interview or intake interview, these are all interchangeable terms, that this process can last anywhere from 1 session to 3 sessions to really get a handle on an identifiable problem and start to develop a therapeutic or a treatment plan. The first session is going to be paperwork and getting those things out of the way, and towards the end of the session you'll start to begin telling your story, and by the 3rd session you really, with your therapist's help, will really have fleshed out what the presenting problem is and start to move in the direction of developing a treatment plan that will best suit the needs that you are presenting with and the best therapeutic intervention to assist with that problem area. Thoughts, feelings, behaviors. Those are all connected. And if you make an intervention in any one area, behavior or thoughts, feelings will likely change as well. So a cognitive behavioral therapist will really help you to look at your cognitions, your thoughts, really understand the difference between cognitions, thoughts, and feelings, and help you to make a change, to change the distortions, to determine if thoughts are helpful or unhelpful, and do some cognitive restructuring to help you have some insight and understanding into your own thought process, the metacognitive process, and also help you to make some changes in maladaptive thoughts. Another type of therapy process that could be used is more of a psychoanalysis or a psychodynamic perspective. So it's going to be looking at interchanges and interactions in relationships and defense mechanisms, and looking at things that happened early on in life and how they sort of play themselves out and manifest in sort of microcosms in our lives, and how different social interactions, social relationships mimic the early process of our lives that we had with our parents and how that manifests itself. There are systemic therapists, there are evidence-based treatments, for example, trauma-focused CBT. That would be a trauma, if you had something bad happen to you and you needed to address that trauma, then you would do it from a cognitive behavioral perspective. So there's many different types of therapies out there. My suggestion would be to, based on the problem areas that you're presenting with, if it's depression or anxiety, there are evidence-based treatments in the cognitive behavioral realm that are out there. And again, if you go to my website, www.drtaji.com, there's a resource tab. Click on the resource tab, and there are links to articles and research from researchers throughout the world that are conducting research in the areas of different disorders and have found certain treatments to be most effective in those areas. Lastly, to discuss How much does therapy cost and the insurance? This is always a difficult question to address because it's my belief that no one should be denied services because of lack of insurance or lack of finances. But the cost of therapy will vary depending on whether you're seeing a master's level licensed clinical social worker, if you're seeing a marriage and family therapist, or if you're seeing a licensed psychologist. That will all vary depending on the discipline and training of the therapist that you're meeting with. In addition, some people prefer to pay in a private pay means. Some people prefer to use their insurance. So one of the first questions that you want to ask a prospective therapist when you're contacting them is, do you accept insurance? Now that's a difficult question because there are many things that go into accepting insurance. So let's go into those. Number one, a therapist has to be on an insurance panel. So let's say, for example, Aetna is your insurance, and the therapist that you would like to go see is on the panel of Aetna, okay? But your particular insurance that you have is an HMO, and the therapist is on the panel for the PPO of Aetna, then that therapist does not accept your insurance because an HMO plan is different from a PPO plan, okay? So you need to call your insurance company and find out specifically if your insurance covers mental health services, how many sessions per year does it cover. Some insurance cover 10 sessions, some cover 20 sessions, some cover 8, some are unlimited. So you need to find out specifically from your insurance regarding that. Number two, you need to find out, do I have a deductible? What is a deductible? A deductible is the amount that you're expected to pay before the insurance will kick in. So if your deductible is $2,000, then that means that the first $2,000 of any of your medical expenses you're responsible for, and thereafter that, the insurance will then kick in after that. So you need to find out if you have a deductible. Number two, you need to know what your copay is. Copays can range anywhere from $5 to $50, so it just varies from insurance to insurance. You need to know what your copay is. You also need to know how much of the service will your insurance pay for. You need to know if it's an 80-20 split, if it's a 50-50 split, meaning sometimes the insurance says we will cover 80% and you're responsible for 20%. Sometimes it's 50-50%. So that's an important question so that you're not stuck with a large bill in the end. So if you need assistance with the process of navigating and negotiating through sort of the red tape of insurance, the therapist that you're seeking should be able to help you with this process. But that should be one of the areas that you start with from the very beginning, is contacting the insurance company, finding out about what they cover, what you're allowed in terms of mental health services. And also the insurance company should be able to provide you with a list of providers in your network that are covered under the plan that you have. So that way you don't find a therapist that you really want to go see and then later find out that your insurance doesn't cover them. So it might be best to go to the website of your insurance company, find a therapist that's on their approved provider list, and contact that therapist. That way you know that you will be protected and you will be covered. So this is some beginning information that I wanted to provide you with. Please remember that I am always open for questions and for comments. You can always post your questions in the comment box below and I will check them. And I will be providing you with another informational tutorial sort of video in another week, since I make sure that we present them every week to you. So I'm always open to questions, comments, statements, or other areas, topic areas that you would like to hear me discuss. Thank you so much for tuning in. See you next time.